And thank you everybody for taking the time to attend today, and welcome to today's webinar. My name is Layla Moomin and I'm the Community Engagement Coordinator for the Canadian Cancer Survivor Network. So thank you for attending the webinar, CCSN's Virtual Action Week Highlights from Our Meetings with Ontario MPPs. I am pleased to introduce our presenter for today's webinar, CCSN's Public Policy Analyst, Conrad Eder. An imaginative and strategic thinker, Conrad enjoys analyzing and understanding all manner of public policy issues. He holds a BA in economics and is an experienced researcher, writer, and educator. A lifelong learner with a passion for all things current affairs, in 2020, Conrad was recognized by the Fraser Institute as a Canadian Young Leader. In today's webinar, Conrad will be providing some insights about our Virtual Action Week and meetings with MPPs in Ontario. He will be discussing the purpose for our meetings, some common themes that emerged during our discussions, and some of the positive outcomes from our meetings. At the end of the presentation, Conrad will be happy to answer your questions. However, at any time during the webinar, please feel free to type questions into the window at the bottom right of your screen. For those of you who have not attended an earlier webinar, the Canadian Cancer Survivor Network is an organization that works with cancer patients and survivors to learn about health system complexities, connect with others to plan action, and act to promote best care and healthier survivorship. If you'd like to learn more about CCSN, please visit our website at survivornet.ca. This webinar is being recorded and it will be available on YouTube. In addition, the slides will be available on SlideShare. Links to both will be sent to the email you provided. I will now turn things over to Conrad.
Thank you very much, Layla, and thank you very much, everyone, for taking the time to join us today. This is my webinar debut, and I'm incredibly excited to be joining you guys today to talk a little bit about our Virtual Action Week and provide some highlights from our meetings, also to talk a little bit about the catalyst of those meetings, which was our COVID-19 and cancer care survey. I'll start off by talking a little bit about the week itself. We had our Action Week from October the 26th to the 30th. You'll notice I put a fairly large asterisk there to remind me, to remind all of you that though it was planned to be a week, we quickly found that it spilt over into the subsequent weeks to the point where my most recent meeting I believe was on Friday. So a very successful several action weeks in which we had a tremendous number of meetings with decision makers. And decision makers, I should mention, from across the political spectrum. We met with MPPs from each of the elected parties and also bureaucrats within the government, in particular Ontario Health, Cancer Care Ontario, many familiar faces, some that belong to our Cancer Caucus, and hopefully some new friends that we can make and new connections. I should also mention that during our Action Week, we strove to put in place a significant online presence. So that includes posting all over our social media channels. I hope some of you perhaps got a chance to see some of those social media posts. And it also included a website, a landing page, where we had a chance to put some clips from our meetings and a little bit more information about our campaign and our key messaging. The purpose of our Virtual Action Week was threefold. The first, we wanted to get a chance to introduce CCSN to those MPPs and decision makers who perhaps haven't met us before, or reintroduce us to those that have. It was a great opportunity for me, given that I've just begun my work here at CCSN a few months ago, to personally connect with a variety of decision makers and introduce myself. Those relationships, I know, are going to be pivotal in the years to come, and it was a great opportunity. Second, we wanted to provide an overview of our COVID-19 and cancer care survey. And as I mentioned, this was really the catalyst of what brought us together. Our COVID-19 and cancer care survey was a national survey that we did in partnership with Leger to get a sense for how the cancer community has been impacted by COVID-19 restrictions. The final and third main objective of our Virtual Action Week was to discuss the explicit inclusion of essential cancer care in all emergency planning. This became an overwhelming theme based on the results of our survey that we needed to address the government and make perfectly clear to them that they needed to understand that there has been a significant impact on cancer patients, caregivers, and pre-diagnosis patients in this country and in Ontario to make sure that they're taking this issue incredibly seriously as frankly, lives are on the line. I'll pause here and take a moment to talk a little bit about the COVID-19 and Cancer Care Survey itself before we dive into our virtual Action Week. First thing I wanted to point out is that we completed a national survey. We had data from across the country, and we completed a total of 1,243 interviews. These surveys took place online between late May and early June. The survey was about 10 minutes long. It covered a variety of questions and was available both in English and in French. There were three primary objectives for our cancer care survey, and I've broken it down into these here. It really was a guiding principles for the kinds of questions that we asked. The first is that we wanted to understand to what extent did COVID-19 restrictions impact cancer care and care delivery in Canada. The second is that we wanted to better understand the mental and emotional toll that these disruptions had on cancer patients, caregivers, and pre-diagnosis patients. Clearly, there's a variety of physical implications, whether or not an appointment was canceled, postponed, or rescheduled, and as our survey talked about, whether or not that appointment took place in person or perhaps virtually. But we also wanted to recognize the emotional and mental toll that these changes had on the broader cancer community. So we asked questions about the mental health of patients, caregivers, and pre-diagnosis patients in this country. Finally, we wanted to identify some ongoing concerns. What were the primary concerns of patients, caregivers, and pre-diagnosis patients in the country? And we had a variety of questions in our survey that tried to get a sense of what were some of the current concerns with current care delivery, but also what are some concerns with the delivery of your care moving forward, even as we begin to get past the COVID-19 restrictions. To tell you a little bit more about our cancer care survey, I put together a video with our president and CEO, Jackie Manthorn. I'm going to play that video for you guys in just a moment. And when we come back, I'm going to highlight a few additional statistics that stood out for me as part of our survey. All right, here we go.
The Canadian Cancer Survivor Network commissioned Leger to conduct a survey to assess the extent to which the disruption of cancer care caused by COVID-19 is impacting cancer patients and caregivers from an emotional and physical wellness perspective.
Our COVID-19 and cancer care survey addressed the following key topics. First, we wanted to know, have appointments been canceled or rescheduled as a result of COVID-19? Next, we asked whether or not patients had incurred delays in their diagnostic testing or treatments. Third, we looked at whether or not patients avoided going to the ER, even if they encountered symptoms related to their cancer diagnosis. Fourth, we asked, have patients lost or had their private health insurance benefits impacted over the course of COVID-19? Fifth, we wanted to know what were the emotional and mental impacts of having a diagnosis or treatment delayed over COVID-19. Sixth, we wanted to know how patients and caregivers were interacting with their doctors over COVID-19. And finally, we asked whether or not clinical trial participation was impacted.
Leger conducted a 10-minute online survey from May 22nd to June 10th in both English and French. Altogether, there were 960 cancer patients, 206 caregivers, and 77 people who were actually in the middle of having their cancer diagnosed, for a total of 1,243. The survey was available in both English and French and covered the whole country.
Our cancer care and COVID-19 survey can be summarized in 4 key results. The first is that we found there was a considerable disruption to many aspects of cancer care in Canada. More than half of cancer patients, their caregivers, and those awaiting a confirmation of a cancer diagnosis report appointments canceled, delayed, or postponed. Second, our survey found that telephone consults largely replaced in-person visits during the pandemic. Of those who were able to interact with their physician, 83% did so over the phone, with very few consultations taking place virtually. Unfortunately, almost 3/4 of those surveyed remain concerned about their ability to access in-person care, particularly being able to be cared for in a hospital or emergency room setting. Third, we found that there was a significant mental and emotional toll on patients, caregivers, and pre-diagnosis patients. The majority of those who experienced delays in appointments and treatments said that those delays had a major impact on their emotional and mental health. Among those who experienced delays, caregivers and those awaiting a diagnosis were significantly more likely to report being mentally and emotionally impacted, nearly 90%. And finally, our 4th key finding. We found that there are still broad concerns about the ability to receive adequate cancer care in a timely fashion. More than 50% of survey respondents were concerned about their ability to schedule appointments and receive treatment. Further, 70% of patients awaiting diagnosis are concerned about delays in diagnostic testing and procedures.
And there we are, we're all back now. So now I'd like to jump into a few particular observations of mine, what stood out from the survey. As you saw in the footage that we just watched, we identified a variety of areas in which cancer patients were impacted over the course of COVID-19. But one in particular I wanted to highlight again was how they were able to interact with their physician. Our survey found that the majority of patients who were able to interact with a physician did so over the phone, with very few taking place virtually. Unfortunately, we don't have an entire picture as to why that's the case. Our survey didn't specifically ask patients whether or not they triggered a telephone consult or whether or not it was put in place by the physician. It's hard to exactly say, but I can say from the meetings that we had with many patient advocates over the last few weeks, but also from anecdotal evidence in speaking with many individuals, it would seem as though virtual consults would seem to be the preference when it comes to receiving care, if not in person. And yet we see this telephone consult quite high. As I said, 80%. So the vast, vast majority of those consultations taking place over the phone. But as I mentioned in that clip we just watched, nearly 3/4 of those surveyed remain concerned about receiving in-person care. This is definitely something I'd like to follow up on, and I'm going to continue to keep an eye on as time goes on, as to how patients are able to interact with their healthcare provider, whether it's over the phone, whether it's in person, or whether it's a virtual consult. And again, trying to get to the bottom of who's triggering those consultations. It's quite possible that cancer patients are preferring the convenience and essentially the speed of being able to speak with their healthcare provider over the telephone. In speaking around the office, but also again with many patient advocates, it would seem as though virtual healthcare can be a great option so long as it is implemented correctly. So I'm going to keep my eye out on that. The second thing that stood out to me from our survey was that part of the survey asked what some of the greater concerns or fears were of respondents. Now, this may or may not surprise you to hear that patients expressed a greater concern or fear of getting COVID-19 than of their cancer itself. Now, I think this could potentially clue us into our next thing, or I should say, the next thing that stood out to me, which was the fact that pre-diagnosis patients personally chose to cancel or postpone their in-person appointments as frequently as their doctors did. And it would seem that the two of these findings really come together to say that cancer patients, but again, the broader cancer community, is quite concerned about the delivery of in-person care whether that's in a cancer center, a hospital, an emergency room, as was mentioned in the previous clip. And this data suggests that entirely. We found that 36% of pre-diagnosis patients personally chose to cancel or postpone an in-person appointment, whereas just slightly less than that, 34% of pre-diagnosis patients experienced an in-person appointment being postponed or canceled by their doctor. I think this really hits in on a final point I'll make on this slide, which is that the messaging is critical when it comes to expressing concerns and also reassuring the cancer community of the safety of visiting healthcare settings to receive treatments or diagnostic tests. It would seem there could be a disconnect here, as I mentioned, with this significant concern and fear of getting COVID-19. We need to make sure that we're getting an appropriate message out, addressing any concerns that exist, and ensuring that cancer patients are able to step into healthcare settings to receive their necessary treatments or diagnostic tests, while also being able to provide virtual healthcare where deemed acceptable. Next, I want to jump back into our virtual action week, and this will give us a chance to talk a little bit more about it. I prepared another video, a highlight package, if you will, again narrated by myself and Jackie. And this next video package contains clips from a variety of the decision makers and MPPs that we met with. It also features several clips from the patient advocates that took time out of their day to join us over the course of our virtual action week. And I'm going to play that for you guys now. When we come back, I'm going to wrap up a few final thoughts from our virtual action week and tell you a little bit more about some of our outcomes.
Unfortunately, many of our worst fears during the first wave of the pandemic seem to be coming true. We are already beginning to see the devastating consequences that the cancellation and postponement of essential cancer services have had on patients and survivors. On October the 24th, the Toronto Star reported that cancer surgeons in Ontario are witnessing a sharp rise in the number of people coming to the hospital with advanced cancers. The sudden suspension of screening services for breast, cervical, and colorectal cancers during the first few months of the pandemic meant that fewer cancer cases were being diagnosed at their earliest and most treatable stages. This has led to an increase in patients requiring more intense surgery and longer hospital stays, and potentially seeing poorer long-term prognoses. Now that we have learned important lessons from the first wave, we strongly urge all governments in Canada to heed the experiences of cancer patients, survivors, and caregivers, and to recognize that cancer can't wait. In order to get this message across, CCSN, along with patient advocates, met with MPPs across parties. During these virtual meetings, we shared the results of our Leger survey, stories from cancer patients and survivors, and discussed how we can work together to ensure that cancer care remains a priority during any pandemic. Over the course of our meetings, it became clear that many MPPs already recognize the gravity of the situation and the failure of the government to prioritize cancer patients.
I think what's your evidence has really shown is something that a lot of folks don't necessarily recognize, and that is the province's lack of planning with COVID-19. I mean, we were not prepared, despite the government indicating with many words that they were for the first wave, and now we see the second wave hitting us. And I heard all throughout from surgeons who hands were tied. They weren't able to access operating rooms. And further, they were simply stuck waiting on their hands. And you know, I'm glad to see that the province has now committed. One of the things that the official opposition has been calling for, which was increased funding to clear the backlog. But with a progressively deadly disease such as cancer, you know, putting a Band-Aid on it at this point isn't isn't going to help. I'm scared to think, as you say, what our results will be in the next 3 to 5 years.
Um, Certainly, a lot of the information that you have shared with me in terms of the concern and the anxiety that individuals might have about their cancer care is not at all a surprise. We've certainly been hearing it for the last few months, and certainly there's been a lot of concern, especially when surgeries had also been put on the back burner. So I'm hoping that the fact that we've moved into a different phase of this pandemic has allowed for some of those important and urgent surgeries to be back on the front burner and to be dealt with. But you're also describing the situation of a lack of being able to get the diagnosis in advance of leading to the actual care. You're talking that we've learned a lot, Conrad, the last few months as a government, but also as all the health partners have now adjusted. You know, it isn't those early months where people did not understand the virus at all and didn't know how to cope. We've now learned so much more about it. And so I think we are able to put in the kinds of resources and tools now to be able to actually, you know, work with it or work around it. And also to address some of the concerns that patients would naturally have. I mean, you mentioned earlier that patients were even just afraid to go to their doctor's office. And if you are someone who's actually vulnerable with a critical illness, you don't want to expose yourself to the threat that you might actually catch COVID or something else. So all of those things would just simply have heightened their anxiety and their concern for their health, and not to mention the caregivers as well. So I think though, so at this stage in the pandemic, we all have far more knowledge about what we're dealing with, and therefore how to be able to be responsive to a patient who might be a little bit more vulnerable to the virus.
The messaging from the government has to be very clear as to what our individual responsibility is, so that we can make sure that our loved ones get the cancer care that they need, or an orthopedic surgery that they need. And especially those situations that are obviously life-threatening. So there's there's a pieces the government needs to put into place that aren't specific to cancer that will support exactly what you're suggesting. And a lot of that's around testing and contact tracing, clear messaging, right? Clear guidelines, reinforcement of what the right things are to do. And how do we live with COVID? How do we manage our risk? And if you have complex risks, whereas you have a medical condition or two and you've got COVID, people need help in managing that, knowing either it's safe or it's not safe, or understanding like the actual risks that exist for them.
I think that the messaging about it being safe is so important. So I think that is definitely something that we need to be able to bring back. I also think that the government kind of struggles when it comes to certain messaging, because they're very, it is easier to have a one-size-fits-all message, but cancer care is not a one-size-fits-all. Depending on what the treatments are or what kind of cancer you're facing, certain things are easier or not as easy to do. And I need them. I'm now part of your team, so so I think that part of it is for us to, like, they need to disentangle, just like you did when you were explaining to me what the differences would be if you're going in for the mammogram versus going in for some other kind of test, right? And if they did that, then they might be able to better encourage people to come out to their appointments, because then they would signal that they understand what cancer care looks like.
Can't wait. And now we're starting to see that evidence with that article that came out, that the cancers that are being diagnosed right now are much more advanced. And I received some data also from the Ontario Medical Association that they stated that about 14.5 million patient visits were missed because of COVID. So, I cannot imagine the impact on the population and how many different diagnoses and tests were missed in that time.
As important as it is to focus on statistics and the sheer number of cancer patients impacted by COVID-19, it's equally important to recognize that each individual person has their own unique cancer journey. We were fortunate enough to be joined by cancer patients and survivors who shared their experiences with us.
And now almost 2 years wait to have, crucial testing for the side effects from my cancer treatment that I had in 2015 and 2016. Having appointments with people on the telephone does not alleviate anxiety. We sit here waiting and wondering whether or not cancer's come back, whether or not we've got cancer, whether or not we've turned metastatic. And it's really challenging to try and find some calm in the storm, if you will, especially with everything going on, and for people not understanding that you are also immune compromised. Walking around or being extra protective is really challenging, and having those delays just adds so much more to that anxiety, and really is hard during this time because we have enough stress as it is, and this is just, more than the icing on the cake. It takes it beyond. So
my doctor's appointments, most of them were canceled in person, and I did many of them virtual, which is a concern because without the doctor's eyes on the patient, especially someone with my diagnosis, it's going to be really hard to sort of hear a voice over the phone when you can't do the blood pressure checks, when you're not doing temperature checks, when you're not doing the physical examinations that I was used to getting from my oncologist. So that all stopped as well for a long time. And so my doctor had to really rely on me being able to transmit to him how I was feeling, what I was doing. And I wasn't doing very well. So after the clinical trial did not work, I started chemotherapy in the very beginning of May. So right in the middle of all the shutdown. And so I did have access to the cancer clinic to continue my chemotherapy. It was nerve-wracking at first to go. In the end of April, I was actually admitted into the hospital because I became quite sick, and my team always says go to the ER, which was terrifying, and I'm going to be very honest about that during COVID. The ER in my hospital is not designed for the amount of people that use it right now. And even though they did their best, masking, trying to do social distancing, patients are sitting in chairs in the hallway of the ER. And when you have a waiting room that you're able to go into, it's a very small waiting room. Usually there's 6 patients that sit in there. So they kept us to 3, but my knee, I could easily reach the knee of the next person sitting in the ER with me. I resisted going to the ER, even though they told me go, I would wait. Just because of this concern about, well, how safe am I if I go? I'm stage 4. Who knows what's going to happen to me with lung cancer if I get COVID? So that was an incredible stressor for me, accessing the medical system. And I had to go again at the end of August as my cancer continued to progress. The chemo did not deal with it. I was told again, go to the ER. I waited 3 weeks before I went in, and I got sicker and sicker, but I had no choice at that point. I went in, I was admitted for 9 days in the hospital. And again, I ended up in the cardiac ward because I had heart issues because of things that were going on with the progression of my cancer.
Lung cancer patients are often already diagnosed at a very late stage. The impact of the pandemic has been very extreme because those people are not getting diagnosed. It's definitely going to lead more, it's clearly going to lead to more deaths for lung cancer patients because they're not going to get to treatment as soon as they need to. So that's just a huge cost to the healthcare system and to Canadian society, frankly. So a lot more needs to be done to move the diagnostics along and make sure that people are accessing that and aren't afraid to go in and have those things checked out, go to Emerge if they're having symptoms. And press for the kind of healthcare that they would have pressed for with their family doctors, with the emergency room physicians, if before the pandemic. So I would really echo what Jackie has said about the fact that there has to be a voice out there telling people it's safe to go and that they need to go. I would say lung cancer patients also reported a lot of fear over not receiving treatment at all if the emergency rooms, the intensive care facilities become overcrowded and maxed out during surges in the pandemic like we're experiencing now, frankly.
Good afternoon, everyone. Thank you for having me today to talk about this very important issue surrounding COVID-19 and cancer patients. I am a lung cancer survivor advocate who had surgery for lung cancer in 2014. I am now a 6-year survivor. During this time, I have chosen to advocate for those cancer patients who can't advocate for themselves. I am currently the chair for the Programs Committee at Lung Cancer Canada, and I sit on the Advocacy Committee for the Lung Health Foundation. As well, I have initiated a Facebook group, the Canadian Lung Cancer Advocacy Breathe Hope. This group is for Canadian lung cancer patients and caregivers. In this group, there were many discussions surrounding COVID and how it has affected the group as a whole. Since initiation of COVID, the group spoke about their concerns and how it has affected their treatment during the pandemic. Most patients found their infusion and oncology appointments were canceled with no response. As to when they may take place in the future, there is still no answer. These infusions are considered the lifeline of a stage 4 lung cancer patient. Any interruption in this care can result in progression of the disease, something a stage 4 lung cancer patient cannot afford with so little treatment options already. As well, I came across a woman who had to wait for surgery. She was diagnosed at stage 1, which is considered a survivable stage, only to be told her surgery was canceled until further notice. Her surgery was then rescheduled for 6 months after the initial diagnosis. The group also talked about contracting COVID and how this would affect their treatment and their concerns about living with lung cancer and a COVID diagnosis. The discussions went to a dark place. What would the doctors do if you had 2 patients in the ER with COVID, and one was a lung cancer stage 4 patient, and one was a healthy individual, and there was only one means of treatment, such as a ventilator? The reflection from the group was that stage 4 lung cancer patient would probably not get the same treatment, if at all. This is just unacceptable, even in a pandemic situation. In my opinion, I would have to say that the healthcare system in Ontario has let its cancer patients down when they needed it the most. This cannot happen again. As another wave hits, we could have another public health crisis on our hands, which would cause more devastation to the cancer community.
We were also grateful to be joined by patient advocates who discussed how the patients they work with have been impacted by the pandemic.
We don't have concrete data on how COVID-19 is affecting lung cancer patients specifically. We're hearing a lot from our patient community and from healthcare providers that COVID is only really augmenting the challenges specifically for this population. So as Conrad mentioned, every aspect of cancer diagnosis, surgery, treatment, follow-up, clinical trials, and supports has been affected during the pandemic. As you might know, lung cancer is the leading cause of cancer death in Canada. It is responsible for more deaths than colorectal, breast, and pancreatic cancer combined. So increased delays in testing and in receiving treatments is really not an option for lung cancer patients because of the really aggressive nature of the disease. So almost 50% of lung cancer is diagnosed at stage 4. Another 30% is diagnosed at stage 3. So early detection is really integral to improving survival rates and ensuring that patients have various treatment options. And while there's no comprehensive lung cancer screening program in Ontario, there is a pilot program running. It's been running for the past 3 years. Unfortunately, it was shut down due to COVID-19 for 4 months. So right now what's happening is that there's extremely large backlog and a long wait for patients to actually access screening. So I guess what's unique from lung cancer compared to other cancers is that not only is there a dire need to manage this backlog of patients when it comes to screening, but also there's a need to implement a comprehensive lung cancer screening program, which British Columbia just announced. They're the first province in Canada that will be doing so. But again, all the other provinces are lacking this right now, and this exists for other cancers such as breast.
By the end of our meetings, the MPPs seemed eager and ready to work toward helping us spread our message that cancer can't wait. In fact, MPP Franchelinas delivered a poignant address in the legislature.
The member for Nickelback. Thank you, Speaker. I met with members of the Canadian Cancer Survivor Network yesterday. They wanted to share their new patient survey with me. The report shows that the delay in cancellation of cancer care due to COVID-19 has triggered another public health crisis. Cancer patient, their caregiver, and those awaiting confirmation of a cancer diagnosis are facing postponed and canceled appointment, tests, and treatments, causing heightened fears and anxiety, even as the pandemic restrictions are lifted. We need to get our healthcare system moving again in the interest of people's health. Safe and timely access to cancer care, including diagnosis, testing, and treatment, must remain a top priority, even during the second wave of COVID. The report says that to save lives, cancer care and diagnosis must continue during any public health crisis. Speaker, Ontario Pandemic Plan must explicitly include essential cancer care. Cancer can't be cancelled or postponed. Cancer survivors want a system that never cancels treatment, tests, or diagnostics procedures for cancer patients. I believe we can get there, Speaker, but I have some serious doubts in this government's ability to get us there when they seem to prioritize pinching pennies and backroom deals for their friends. Speaker, cancer can't wait.
And we're back. So as you can see, we had a tremendous number of meetings, both MPPs and other decision makers. And we were joined by some tremendous advocates who, I might add, were phenomenal in their contributions to the meetings. They were asked to make statements live on camera, which I can say from personal experience can be stressful from time to time. So their contribution was incredible. I'd like to key on a few key takeaways from our virtual action week. And I'll begin by saying that we met with more than 25 decision makers. And this was across various MPPs covering all corners of the province, but also a variety of decision makers within Cancer Care Ontario and Ontario Health, with whom we shared our message that cancer can't wait. As you just saw, a phenomenal statement was made in the House by MPP Franchelinas. And on a brief aside, for those of you who might be watching and planning a virtual action week in the near future, I'll mention that this statement in the House was incredibly impactful for our campaign. I should note that shortly after the statement in the House, in the subsequent day or two after, we had several MPPs RSVP to meet with us. And for that, I just thought I would highlight the significant impact that a statement in the House can have in terms of ensuring that MPPs are once again reminded about the importance of an issue and are incentivized to reach back out to us and confirm meetings. The third takeaway was that all of the decision makers that we met with agreed with our ask. We specifically went into the meetings to reference the importance of ensuring that cancer care is included in all emergency planning in the province of Ontario. Specifically, we asked everyone we met with to speak with either in person or by writing the Minister of Health to implore her to heed the experiences of the cancer patients and caregivers that we surveyed in our national COVID-19 and cancer care survey. We were incredibly overwhelmed by the positive response that we received. All the decision makers agreed to our ask and were very supportive of our initiatives. Fourth, I want to touch on opportunities to amplify our message. We were very fortunate to meet with a number of MPPs who took a particular interest in this issue. And as a result, we've identified a few different opportunities to help amplify our message of ensuring that we're addressing the concerns of cancer patients, their caregivers, and pre-diagnosis patients when it comes to interacting with the healthcare system and visiting for in-person appointments. I'm going to continue to explore that on my end, and you can look forward to some messaging from us in the time coming. Finally, I want to mention again the importance of our continued relationship building. Not just for me, since I'm new to CCSN, giving me an opportunity to introduce myself to decision makers in Ontario, and likewise for them to get to know me, but also for our broader initiative. We had an opportunity to reconnect with a number of MPPs that are familiar with CCSN and its mission, but also meet some new MPPs and decision makers along the way. These relationships are incredibly important, and I'll look forward to building on them in the time ahead. Now I want to pause for arguably the most important slide in my entire presentation, and that is to thank the advocates that took time out of their busy schedules to join us and help us get our message across to decision makers during our virtual action week. Jessica, Diane, Marianne, Jenny, Deborah, Nadine, and Andrea all played a pivotal role in getting our message across and imploring MPPs and decision makers to hear our message. Now, in some of our meetings, we didn't have a patient advocate, and instead we took some time to read some patient stories and comments that we received as part of our national survey. But I can tell you that the majority of the meetings when we did have a patient advocate present, the difference was night and day. The impact that these advocates made in sharing their personal stories, which is not easy to do, in sharing their personal stories with decision makers, it made an incredible difference in getting our message across. And I can tell you for a fact that our virtual action week would not have been the same without them. So again, I wanted to take an opportunity to acknowledge them and their phenomenal contributions. Again, thank you all so much. Finally, I want to share a few pieces of great news and sort of a looking forward as I wrap up my presentation portion of the webinar. The first thing that I want to highlight is we have a second survey underway. And as an analyst and a bit of a stats junkie, I'm overwhelmed. This is fantastic news. I'm really excited that we've been able to partner with Leger once again to have a second national survey examine many of these similar threads that we've already looked at in our first survey as a point of reference and comparison to see where we were and now how have things developed over the subsequent weeks and months. This is an incredible development that will allow us not only to compare and contrast our prior data, but it's going to give us an opportunity to reach back out to decision makers, MPPs, bureaucrats, and really drive home our message. The survey was very well received during our virtual action week, and we'll look forward to hosting more virtual action weeks in the future, not only with our first survey, but also with the momentum of a second survey to, again, bring to light and ensure that we're keeping this on the front burner for politicians, the importance of acting when it comes to cancer care delivery in this province. As I alluded to, more virtual action weeks to come for sure. This has been a phenomenal experience for CCSN being able to reconnect with a number of MPPs and decision makers and get our message across in an absolutely positive environment. We look forward to hosting more virtual action weeks and cooperating with more advocates to make sure that we can get their personal stories conveyed to decision makers to motivate change that we need to see in this province, because cancer can't wait. I also wanted to highlight messaging campaigns and the importance that we've heard from our advocates, but also through our interactions with MPPs, the importance of addressing concerns from the cancer community when it comes to the delivery of care. We've identified a few MPPs and decision makers that we're going to be looking to work with to put out additional messaging to make sure that we're addressing those concerns and make sure that we're getting it very clear in the public eye, the importance of in-person appointments. And as the footage that you saw today from our virtual advocates, they themselves said how important those in-person visits with their healthcare teams are. We want to make sure that our messaging matches that. And finally, I want to reassure everyone watching both live and those that will watch the webinar in the not so distant future that CCSN, I myself, and our entire team are fully committed and will continue to work with decision makers in Ontario and across the country when it comes to distributing our message that cancer can't wait. This second survey is just going to be a second catalyst to ensure that we're having this incredibly important conversation, and I'm incredibly excited to see it through. With that said, I'll wrap up my presentation here. And once again, thank you all so very much for taking the time to join us live. And of course, thank all of you who will be watching it recorded in the future. I left my contact details up on the screen, and you're more than welcome to reach out to me by email or phone if you have any specific statistical questions. I should also mention that we have a tremendous data set as part of this survey. And whether it's for your own curiosity or perhaps your own advocacy efforts, I'd be happy to dig into the stats and get some specific answers to your questions. You can always feel free to reach out to me and we can really dig into it. Again, thank you all so very much for taking the time to join me today.
Wonderful. Thank you so much, Conrad, for that presentation, for sharing some of those highlights with us, as well as some of the insights that you had from the various meetings that you participated in. So we still have a bit of time left to have a bit of a Q&A session. So if you haven't already submitted a question, there's still some time to do that, but we'll get started with some of the questions that we do have. So our first question: one of the issues that cancer patients have had to deal with because of COVID-19 has been dealing with insurance companies. Was this addressed in the first survey, and will it be addressed in the second survey?
Absolutely, it was. Let me pull up our details on that so I can give you some specifically some talking points on that. We did address it. We specifically asked whether or not private and public insurance benefits were impacted over the course of COVID-19. And we did find that that was the case. And to be specific to your question, we have again included that in our next survey. I want to make sure that I have our details here. Yes, absolutely. Another major concern that we had when speaking about insurance companies was talking about the ability to fill prescriptions and access to medications. That was another concern that was piled on top of this question. In our second survey, we're going to continue to ask those questions about whether or not access to medications and access to treatments have changed, and if so, how. We're going to continue to ask questions like how, if at all, have your private and also public insurance benefits changed over the course of the pandemic. We really want to make sure we're comparing and contrasting our first and second surveys. So we'll look forward to putting together more data in the near future on that, and specifically addressing how has the situation of insurance changed over the course of the pandemic.
Great, thank you. So next question, has CCSN conducted an assessment of how many people with oncology were impacted versus how many people were directly impacted by COVID itself?
Oh, that's an excellent question. Absolutely. That's something that we'll continue to look at in terms of making those differentiations between groups. Our survey that we conducted primarily looked at three categories. The first were cancer patients, so they could have been diagnosed at any time. We looked at caregivers, so those that were directly involved in taking care of a cancer patient, and pre-diagnosis patients, so those that are currently undergoing diagnostic tests to determine whether or not they may have cancer. And I stumbled over my words there for a moment because I should also include a fourth category that we looked at, and that was recently diagnosed patients. So we specifically isolated those that were diagnosed within the last couple of years. The data that we retrieved, specifically isolating those cancer patients and caregivers, we asked how their levels of anxiety and concern, for example, differed over the course of the pandemic. What we found is that caregivers on average were slightly more concerned at the beginning of the pandemic, and both their concern and fear for COVID-19, for their health, increased as well as patients, but still staying a little bit higher. And as we've begun to more or less get used to the COVID-19 restrictions, both cancer patients and caregivers have seen a slight decrease in their overall stress levels, but not back to the point that we were at the beginning of the pandemic. We're going to continue to look into more and more comparisons between how caregivers and patients have been impacted. In particular, one of the conversations we had during our advocacy week is how the role of the caregiver has changed slightly over the course of the last several months. And I believe one of our patient advocates referenced that in some of the footage that we played for you guys today. was that patients are, in some cases, no longer able to have a caregiver or someone accompany them to their in-person appointments, should they have one. That's been a significant point of anxiety, not only for the patient, but also for the caregiver.
Awesome. During your presentation, you talked a lot about how many cancer patients are nervous about going to hospitals in order to receive treatment. In your meetings, were you able to come up with any solutions for how we can encourage people to access their treatment?
Absolutely. And that gets back to my mentioning of messaging. Messaging would seem to be very important. As I pointed out in our survey, one of the things that stood out to me is that cancer patients reported being more concerned and more fearful of COVID-19 than of cancer itself. And something we've been discussing around the office is that would tend to suggest that the public messaging around COVID-19, though perhaps not effective for the entire population, has arguably been too effective when it comes to cancer patients and those in the cancer community. Something we'd like to do at CCSN, and we will be reaching out to many of the decision makers that we spoke with during our virtual action week, is try to prepare some improved messaging to get out to the cancer community to really address key concerns, because there absolutely are concerns within the cancer community, to address those concerns and encourage visiting hospitals, healthcare settings when it's necessary. As I said, there would certainly seem to be an appropriate place for online consultations or telephone consults, but above all, the message that we heard in our survey and hearing from many of our patient advocates is they really would like that in-person treatment. Not only does it make them feel as though that their concerns are being better addressed, it puts them more at ease on a psychological level, besides the physical benefits of having an exam.
Great. Next question, what systems exist for cancer patients to connect with their doctors virtually?
Well, that's been a good point, and it's something that we looked into as part of our survey. We asked cancer patients, caregivers, and pre-diagnosis patients, how were they interacting with the healthcare system over the course of COVID-19? As I highlighted too in particular during my talk today, the primary method was over the phone, and video consultation was another that I mentioned in particular. But I should also point out that email was something that came up, even text messages were two other methods that cancer patients, caregivers, and pre-diagnosis patients were using to stay in touch with their healthcare teams. Again, our survey didn't specifically ask who triggered that mode of interaction, so we can't say for sure why we've seen a majority of consultations take place over the phone. As I said, I don't want to jump to the conclusion one way or another whether or not that's something that the broader cancer community is okay with, because as we did hear from some advocates, they do enjoy the convenience of being able to speak with their oncologist or healthcare team quickly over the phone. But again, I don't want to minimize, and in fact, I want to make sure that I'm clearly expressing how important those in-person consultations are. Ultimately, we want to make sure that each individual cancer patient is receiving the treatment that is most appropriate and best for them. If that's over the phone, and that's the way that they would prefer to consult with their healthcare team, that's fine. But we want to make sure the option is there for in-person care, as we've heard from many that that is their preferred delivery from their healthcare team.
Great, thanks so much, Conrad. So we're just about at the end of our time here, so I think we'll wrap things up there. If you have any further questions about the survey or about anything pertaining to our virtual action week, as Conrad mentioned earlier, he's happy to take your questions and his contact information is there for you to reach. So thank you again, everybody, for attending the webinar today. We were really excited to be able to share with you the results of our virtual action week, our first virtual action week. We hope that this was very informative for you and that this can actually also help with any advocacy efforts that you're participating in the future. So CCSN has 2 more webinars coming up before the end of the year. We have the last 2 webinars in our Remarkable Cancer Survivors Guide series. So there's another webinar on December 9th and December 16th. So we hope to see you next week. Take care, everybody, and thanks again for joining us.